My dear friends, today I am going to discuss a very important topic, that is COVID-19 and how it affects nervous system. All of you know we are passing a stage of a pandemicity by COVID-19, and it has touches almost every part of globe. With time, the number of mortality and morbidities are increasing, and patients or the subjects was already existing, suffering from existing heart disease, diabetes, immunosuppressive drugs, or even immunological problem, they are, or respiratory problem like asthma, COPD, they are more prone to this infection. And at the same time, it has been also been shown that respiratory system is the most important system that is affected by this COVID virus in the human body. So lung is the most important organ that is involved, and in the latest critical stage of the disease, an individual or a COVID-19 positive patient may die because of acute respiratory distress syndrome or respiratory failure or severe pneumonia. The question comes whether this COVID-19 has any effect on the central nervous system or peripheral nervous system and brain. So today's topic deals with COVID-19 and how it affects the brain and nervous system. Now, according to various researchers, COVID-19 is a mainly respiratory virus which is transmitted through sneezing or aerosol or droplets through one's respiratory system. So it's mainly a respiratory virus, and which transmits via coughing or sneezing out. That's why in preventive measure it is always advised to wear a mask. But recent researches has been shown that it has some neurotropic effect also. This COVID-19, like other coronaviruses and SARS virus, it shows some neurotropic effect also. Means it has some affinity for neurons also. And we must know that this COVID-19 virus has affinity for one receptor known as angiotensin converting enzyme 2 receptor, which is present in the epithelial cells, mostly in the lungs, heart also, and also in case of neurons, it is also present in neurons, glial cell, even in the brainstem. That's why these neurons which contain the angiotensin converting enzyme 2 receptors must also be infected by this COVID-19. Thus, from the various clinical features presented by the patients after being exposed to this COVID-19, it has been shown that many of them suffer from anosmia or loss of taste sensation. So what is anosmia? Anosmia means loss of smell, and taste sensation means loss. The person cannot feel the taste sensation. This proves that the COVID-19 has some neurological effect also. The question comes how it affects the brain. That we will discuss. So just now I told that it has angiotensin converting enzyme 2 receptor affinity. So it binds with this angiotensin 2 receptor, which is also present in the neurons, glial cells, and even in the brainstem. So this COVID-19 virus, once it binds to the receptors present in the neurons, it enters into the neurons and make it the host cell, and ultimately can multiply there and can directly damage the neurons. And it may cause damage, thus it may cause direct damage to the brainstem, and ultimately it may leads to respiratory failure, and patient may go into a stage of respiratory failure because of ARDS, acquired respiratory distress syndrome, and patient may die because of respiratory failure. So thus we can see that this COVID-19 has some neurotropic effect and can have some effect on CNS also. in this topic today we are going to discuss how this COVID-19 may cause the CNS effect, or how it affects the CNS and brain. Now, it has been seen in few patients that they present with the sign symptoms of loss of smell and taste sensations. So now all of you know the smell sensation is carried by olfactory bulb. So it has been suggested that the virus may have transferred or entered via the nasal mucosa, which is rich in angiotensin converting enzyme 2 receptors, and it affects the olfactory nerves endings, and from there it enters the olfactory bulb, and olfactory bulb is present in the frontal lobe, and thus it involves affect the brain. So from the nasal mucosa, the virus, as soon as the person inspires or inhale, the virus along with the air enters and deposits in the nasal mucosa, and which contain lots of olfactory nerve endings, and it touches the nerve endings which contain lots of angiotensin 2 receptor, converting enzyme 2 receptors, and it binds with the receptors and ultimately travel through the olfactory nerve and up to the level of olfactory bulb. From bulb is located in the frontal lobe. So in the frontal lobe, this virus can reach up to the level of frontal lobe and ultimately can infect the brain. So thus through the transsynaptic pathway, they can also directly infect the brain. So let's see what may be the pathophysiology behind the CNS infection, or how this virus can affect the CNS. So number one, it may be because of directly by hematological growth, or it may be because of neural growth, or it may be because of immunological mechanism also. So what is hematological or hematogenous route? In hematogenous route, the virus enters the respiratory tract during the inhalation, and from there it enters the blood. From blood, it may be traveled throughout circulated throughout the body, and it enters the brain also. And in the brain, it causes injury to the blood-brain barrier because of inflammation. And because of the disruption of the blood-brain barriers, it directly enters the brain, ultimately directly injure the neurons because of inflammation. So there it may leads to various sign symptoms and clinical manifestation of various CNS sign symptoms or CNS diseases. Also, there is maybe another route called a neural route. What is the neural route? The neural route may be because of transsynaptic route. What is transsynaptic route? Here, by the olfactory bulb or olfactory nerve endings, directly it enters directly without binding with any receptors. It directly involve the olfactory bulb and ultimately travel to the brain. There it causes reactive extrogliosis and activation of the microglia, and there it causes massive neuroinflammation, leading to a production of a cascade known as neuroinflammatory cascade, which at the same time it also causes disruption of blood-brain barriers and leads to neuronal cell death. And because of this neuronal cell death, it leads to acute brain encephalitis and infective toxic encephalopathy, and another name is acute necrotizing encephalopathy. So what is this acute necrotizing encephalopathy or infectious toxic encephalopathy? It is a reversible brain disorders. It is maybe because of brain or cerebral edema, and it is because of systemic toxicity, viremia, and medical abnormalities like metabolic disorders. So it is also known as infectious toxic encephalopathy or acute necrotizing encephalopathy. So ultimately, this COVID-19 may directly through the neural route, by affecting without binding with the SU2 angiotensin converting 2 receptors, it can directly involve the olfactory nerves, and through transsynaptic pathway it is carried to the olfactory bulb, where directly it involves the neurons of the frontal lobe and may cause a reactive astrogliosis, neuronal death by stimulating a cascade known as neuroinflammatory cascade. So in this way, it may directly cause injury to the brainstem also, and brainstem injury may lead to respiratory failure Why? Because brainstem contains so many centers, respiratory centers, vital centers, cardiac centers. So once brainstem is infected or brainstem is injury occurs because of the directly damaged by this COVID-19, it may leads to respiratory failure because respiratory center may be affected, and which may lead to the defecting initiation, breathing problem or respiratory problem, and that's why it may leads to hypoxia in the long run. So creation of this hypoxia situation ultimately may again affect the hippocampus or brain, which may ultimately shows the neuropsychiatric manifestation. So you can see that the virus can be transmitted through hematogenous source or hematogenous route. It can be transmitted or transferred via neural route, or another mechanism is via immunological response. So what is immunological response? Now the virus, it may be inhaled or via respiratory tract. It has through AC2 receptors which is present on the pulmonary epithelial cells. It may directly cause severe pneumonia via causing pulmonary alveolar damage and may leads to acute respiratory distress syndrome. Now there, at that stage of acute respiratory distress syndrome, there will be systemic inflammatory response syndrome, also known as cytokine storm, where there is a severe increase in the count of cytokines or secretion of cytokines in response to the inflammatory changes that occurs in the body due to ARDS. And because of this cytokine storm, it may stimulate a hematological abnormality. That is, it may stimulate the coagulation pathway, and it may cause coagulation abnormality and leading to DIC. What is DIC? Disseminated intravascular coagulation, and because of the DIC, there will be a chance of thrombotic disorders. So increased thrombosis may occur in the intravascular area. It may be in the heart or in the brain. If it occurs in the brain, in the major vessels, it leads to stroke or cerebrovascular accident, which leads to the neuronal injury. So in this way, mainly by hematogenous route or neural route and by immunological response, the COVID-19 virus can infect the brain and may cause severe sign symptom of the disease. So what may be the disease or defect it may cause in the CNS? In the CNS, it may cause neurodegenerative disorder or neurodegenerative effect, and because of its neurotrophic effect, it may also lead to stroke. It may lead to seizures. It may also target the cortical neurons. It may lead to meningitis, inflammation of the meninges, and some symptoms like headache, hallucination, some dreams, seizures, and even some neuropsychiatric and behavioral disorders may also be manifested, because sometimes hypoxia and generalized inflammation or inflammatory changes in the blood leads to neuronal injury of the hippocampus, leading to neurobehavioral or neuropsychiatric manifestation. Besides, it may lead to cytokine storm in the later or critical stage of the disease, which may cause brain inflammation and leads to stroke by a stimulation of thrombotic mechanism or intravascular thrombosis in some part of the brain vessels or in some vessels, major vessels of the brain. So these are the pathophysiology of the COVID-19 infection and how it affects the brain. Now it has been seen that it may affect the central nervous system, it may affect the peripheral nervous system, and it may affect the muscles also. Now, how it affects the CNS? In CNS, the patient may present with dizziness because of involvement of neurons. It may present with dizziness or acute hemorrhagic necrotizing encephalopathy. Acute hemorrhagic necrotizing encephalopathy. It may cause infectious encephalopathy, toxic infectious encephalopathy. It may present as headache. The patient may present with headache or altered mental sensation. The patient may present with acute cerebrovascular accident, acute stroke, which may be of ischemic or hemorrhagic type. The patient may present with ataxia and seizure disorders. The patient may also present with confusion, hesitation, and upper motor neuron lesion, which may be because of hemiplegia, paraplegia, or clinical feature of stroke or cerebrovascular accident. Also, we should not forget to tell you that smoking increases the chance of CNS infection by the virus, or smoking person who smokes they have more CNS complication compared to other subjects who don't smoke. This is because the person who smokes, they undergoes regular nicotinic receptor stimulation. Because of smoking contain lots of nicotine that is entering the blood, and because nicotine causes stimulation of nicotinic receptors, and because of continuous nicotinic receptors, there may be expression of angiotensin converting enzyme 2 receptors on the surface of the neuron. It makes the more expression. So nicotinic receptor stimulation causes more expression of ACE2, angiotensin converting 2 receptors on the surface of the neuron, and that's why it increases the chance of infectivity of the neuron by the virus. Because more the number of ACE2 receptors on the surface of the neuron, more is the chance that virus can infect the neurons, and it may affect. More will be the chance of infection, and more is the CNS manifestation or CNS disease by the COVID-19. Now, how will investigate? Now, all of you know imaging science, that is MRI or CT scan, is the most important measures for diagnosis of CNS manifestation. So, MRI and CT scan can be used for diagnosis of stroke or acute necrotizing encephalopathy or encephalitis or toxic encephalitis. These can be better diagnosed by MRI or CT scan. EEG can be taken if there is a seizure disorders. So to see and it can diagnose the encephalopathy accurately also. Besides that, CSF analysis can be done in many cases, but some patients who show CNS manifestation can show no positivity in CSF. Means many patients from various parts of the world, it has been seen in various patients that their CSF analysis shows no positivity. There is no CNS effect due to CSF infection. The CSF does not show any virus, but there is CNS manifestation. This proves that the CNS infection may be because of any other route the virus may have taken. Besides that, we can do blood sampling testing to see whether there is a really coronavirus infection or not, COVID infection or not. Besides, C-reactive protein and D-dimer assay can be done to test whether this C-reactive protein and D-dimer assay plays important role in because D-dimer is diagnostic for DIC or thrombotic disorders, and C-reactive protein shows the systemic inflammation that is going on in the blood. Besides, we can check for cytokine level and leukocyte count, which is very important to diagnose cytokine storm, which is nothing but the critical or later or end stage of the disease, and which may be responsible for DIC and stimulation of stroke. In peripheral nervous system, the COVID-19 patients may also present with dysgeusia, anosmia, neuralgia, visual disturbance, ageusia, dysgeusia, even Guillain-Barré syndrome. And what is Guillain-Barré syndrome? It is nothing but it's a type of peripheral neuritis because of GB Guillain-Barré virus. It's a type of virus, and because of that, it may lead to infection of peripheral nerves and leading to Guillain-Barré syndrome. Okay, and last but not the least, COVID-19 virus also may infect the muscle and leads to direct muscle injury. Because of systemic inflammation, it may directly involve the muscle and leads to muscle injury, which may leads to rhabdomyolysis and leading to the rise of CPK or creatine kinase in the blood. So these are the various effects the COVID-19 creates on the CNS. So what are the various effects of COVID-19 on the CNS? In the CNS, COVID-19 may lead to seizure disorders, it may lead to meningitis, it may lead to acute necrotizing encephalopathy, it may lead to encephalitis, it may lead to stroke. The stroke may be ischemic or hemorrhagic. Actually, ischemic stroke is mainly because of blockage in the systemic vessels or they're supplying the part of brain. So it may be because of stimulation of thrombotic pathway because of cytokine storm in case of COVID-19 infection. So in COVID-19 infection, when there is a cytokine storm in the later part of the critical illness, because of the cytokine storm, it may stimulate DIC or thrombotic situation in the blood and leading to formation of thrombus in some vessels leading to ischemic stroke. And why there is hemorrhagic stroke? The hemorrhagic stroke may occur because of change in the blood pressure as the virus bind with the ACE2 receptor. And all of you know this angiotensin converting enzyme 2 is an important enzyme which plays an important role in blood pressure regulation. So there will be altered blood pressure, fluctuation in the blood pressure in these COVID-19 infected patients because the virus affect the angiotensin converting enzyme 2 receptors, and thus because of hypertension there will be chance of hemorrhagic stroke in brain. Thus, to summarize, we can say that COVID-19 can be a neurotropic virus other than respiratory virus. It has some neurotropic effect also. It is inferiority for neurons because neurons express ACE2 receptors on its surface, which is a receptor for binding the COVID-19 with the host cell. It can be spread to CNS via hematogenous route or neural route or immunological mechanism. In hematogenous route or hematological route, the virus once enters the blood is travels through the whole body and enters the blood-brain barriers by directly causing inflammation of the blood-brain barrier and can directly injure the brain. So, and in case of directly neural route, without binding with the ACE2 receptors, it can directly infect the olfactory nerves and finally travel it through transsynaptic pathway to olfactory bulb, which lies in the frontal lobe, and there it directly involve the brain or infect the brain. Now, when it comes to immunological response, the virus can lead to cytokine storm, and this cytokine storm may lead to systemic inflammatory response syndrome, and because of this systemic inflammation or inflammatory changes in the blood, it will directly stimulate the DIC and leads to stimulation of thrombotic disorder and which stimulates the thrombosis in some vessels of the brain, and which may ultimately leads to stroke or cerebrovascular accident. And also because of systemic inflammatory response syndrome, it may directly cause inflammation of the blood-brain barrier and injure the blood-brain barrier, and ultimately the virus may enter the brain and ultimately damage the brain. And this how the virus may directly cause effect on the central nervous system. Now, what may be the effect of COVID-19 infection or CNS infection? So this COVID-19 infection may lead to encephalitis in brain, it may lead to meningitis in brain, it may lead to seizure disorders or epilepsy-like disorder, it may lead to acute necrotizing encephalopathy-like syndrome or toxic encephalopathy. It may also lead to headache, it may lead to anosmia, dysgeusia, it may lead to ataxia, it may upper motor neuron type of lesion it may produce neuronal psychiatric or neuropsychiatric manifestation or neurobehavioral manifestation, it may lead to confusion, hesitation and even dizziness. So these are the various clinical manifestations of CNS due to COVID-19 infection. In peripheral nervous system also it may cause neuralgia, Guillain-Barré syndrome, then visual problem, ageusia, anosmia, and when it comes to skeletal muscle, it may cause skeletal injury by direct muscle injury because of inflammatory changes in the blood, and which may be proved by increase of creatine kinase in the blood. Okay, thank you very much for today. Please tell me how you like my video.